If health conversations have ever left you with more questions than answers, this Fresh Perspective episode is for you. We're breaking down how different parts of health connect and what real ongoing support actually looks like. Hello, everyone. I'm James Zervios, Vice President and COO of the Obesity Action Coalition. We are very glad you're here today. And today, I'm joined by Dr. Holly Lofton, an obesity medicine specialist who brings both expertise and compassion to this work. Dr. Lofton, thank you so much for being here.
Thanks, James, and thanks to the OAC. I'm excited about this episode of Fresh Perspectives.
Well, Dr. Lofton, let's dig right in. We hear the phrase metabolic health a lot today, but this can kind of sound like medical jargon, no offense to a lot of people. In plain language, what does metabolic health really mean, and why should it matter to someone watching?
As an obesity medicine specialist, I really think this is a welcome form of nomenclature change because we want to look at the entire patient, not just the weight, not just the labs, not just one particular organ. And when we consider overall metabolic health, we're really thinking about our vessels. Our vessels can have inflammation, and when that inflammation exists, that leads to disease in all of our organs. And we know that obesity is one of those conditions that can negatively affect vessel health, thus affect our organs and how we feel generally. So metabolic health is not something that we necessarily see on labs, but we listen to the patient's symptoms as well as their examination and any feedback we can get from procedures and laboratory values to determine one's metabolic health.
And maybe to build on that, Dr. Lofton, when we talk about metabolic health and digging in a little bit more, people are often told that they have obesity, diabetes, liver disease, or even heart disease, almost like they're separate boxes. Can you help us understand how these conditions are actually connected and what's going on in the body?
Certainly, James. When a patient receives a plethora of negative information about their health, it can be very overwhelming. So it's best to present this in a way that we're addressing the root cause. And many times that is the weight condition, whether it's overweight or obesity. Because these small inklings in lab values or a sign such as fatigue or joint pain may not seem as if it's detrimental to health, but ultimately, when combined, this can lead to long-term disease and a decrease in the longevity of one's life. So when we as physicians state that there's an organ that is dysfunctional, let's say it's the heart, we have to look at the entire body and see if it's affecting other organs. And obesity is one of those conditions that, because of the inflammation that's generated with weight conditions, can really affect all of our organs, affect our brain, our kidneys, our liver, our heart. And we want to really try to ameliorate this by effective strategies such as diet, exercise, behaviors, and the other tools we have to treat weight conditions.
And Dr. Lofton, I think, having done this for many years now, you've done this for many years, we always really looked at obesity very singular. But now we're looking at things like MASH, liver health, cardiovascular, and you see a lot of these other things sort of coming to the forefront. But, I think sometimes maybe our folks are confused on are we treating the obesity or are we trying to treat these other conditions? But I kind of feel like, based on what you just said, it's really a holistic approach, right? It's like a wraparound approach to treatment.
Well, we must remember that any organ that's dysfunctional did not occur overnight. There's many reasons, from genetics, environment, and the physiology of one's individual body that can lead to someone at varying weights in their own body at different times having a disease or a medical condition, or when they were a lighter weight they possibly didn't have this. So when we look at the entire patient, we want to make sure that we identify the root cause of MASH, which is a pretty hefty word now, which means metabolic associated steatohepatitis, formerly known as fatty liver disease. And this is a prime example of a silent disease. I'm diagnosing quite a bit of MASH in my weight management clinic now in patients who have no symptoms of liver disease. They don't have jaundice. They don't have pain around their liver. But when we do a scan to look at their liver, they're surprised that there's fatty tissue accumulating. And this can be a symptom of insulin resistance over time, weight gain over time, dietary patterns over time. And we must take small but really intentional changes over a period of time as well to ameliorate these symptoms.
This is a great segue to the next question I had, right? So for someone thinking, I want to be proactive with my health, but I don't know where to start, what are some of these key screenings? You talked about screenings for MASH there, or screenings or conversations you would encourage them to have with their clinician?
Well, I think the first step in that journey is to find a clinician that you trust, you can be open with about how you're feeling, that does not stigmatize you about weight, and really understands that obesity as a medical condition and overweight as a medical condition is something that can be treated with not only diet, exercise, and behaviors. It's more than willpower, but we have effective strategies for looking at the impact of obesity and overweight conditions. So once we identify who that clinician is and you feel comfortable having the conversation, it's good to take an inventory of, one, your laboratory values, two, get a good exam, but also to look at daily patterns, such as how much activity you are doing. We saw a big change in this with the pandemic when people were working from home more, and that decrease in just purposeful physical activity was really impactful for some people. And we started to see symptoms and even disease are related to this change in activity and food patterns. So once you take an inventory of your nutrition, your activity, any genetic predispositions that you have, then we can start to really delve in what the root cause is and start to do those appropriate screenings, such as for heart disease, liver disease, and kidney disease with imaging and other tests.
Yeah, and we hear all the time that people, they just feel overwhelmed by advice. So from your perspective, what are some realistic, doable changes that can support metabolic health without feeling extreme or maybe that like all or nothing approach?
I think one thing that's easy to do once you leave the clinician's office is to then take an inventory of your living space. And let's start with the kitchen area. That's the pantry, that's the refrigerator, and anywhere that you keep food products and drinks as well. And oftentimes my patients come back and report to me, I have a lot of foods in my pantry, but not too many in my refrigerator. And that can be a sign that there's overconsumption of processed foods, and specifically ultra processed foods. These are foods that may come in a bag or box and have a lot of additives to keep them stable on a shelf, unlike fruits and vegetables, which may need refrigeration or at least a special temperature to keep them safe to eat. So that's one of the first evaluations we can do once we leave the clinician's office, and try to move more toward those foods that look like they were natural and less from the ultra processed foods.
Excellent points, Dr. Lofton. And the next kind of layer to this is that we know bias exists. And many in the OAC community have had difficult experiences in healthcare settings. What does meaningful ongoing support look like? And how can people find their voice when they feel unheard in a medical setting?
Well, I can tell you, James, one of the approaches I use when I see my patients. Because even though the door that my patients walk into says Weight Management Center, I ask everyone why they're there and what their goals are, whether it's to lose weight, gain weight, stay the same weight, or to improve their health in a way where their weight doesn't really change. So having someone with that sensitivity about the metabolic disease, about the liver disease that can exist even when someone does not have a higher BMI, or about just general concerns about genetic predispositions to conditions such as heart disease. Someone who's going to listen to your individual goals and treat you with sensitivity as we progress along this journey, because it is for life. The goal is living a long, healthy life and feeling comfortable in your body so we can move throughout the earth with ease.
Dr. Lofton, I love that last part, right? This is for life. This is for the long haul. I love that. You know, and we invited some of our members of the OAC community to share questions that they've had but don't always feel comfortable asking. So let's together take a look at a few of those questions now.
Sure.
Can liver problems develop even if I don't have obvious symptoms?
Dr. Lofton, very interesting question. You talked earlier about liver health and MASH being somewhat silent. So what would you say to this person?
This is an excellent question, James, and thank you to the member who pointed this out, because liver disease is silent in symptoms, but it can also be silent in labs. In my office, I proactively scan patients' livers to see if they have any degree of fatty liver, or MASH as we now call it. And surprisingly, even patients with totally normal labs and no symptoms can have advanced liver disease. So it's important to look at the risk factors for liver disease, such as alcohol intake, history of insulin resistance, or any type of prediabetes, diabetes. Consumption of certain food groups like high fructose corn syrup can increase this risk, as well as not doing as much exercise as recommended. So for someone who has overweight and obesity, I think we should proactively screen for these conditions of the liver before patients have symptoms. So it's fair to ask your provider, how's my liver health?
Excellent answer, Dr. Lofton. Thank you so much. Let's go ahead and take a look at the next question.
Are there any medications that can affect my heart, liver, or blood sugar without me even knowing it?
So, Dr. Lofton, listening to that question right there, I mean, what are your thoughts on this? Are there medications that can impact those things?
This is another great question, and I think it's extremely important, especially for those at risk or living with obesity, to ask your providers about the weight gain potential of any medication that's been prescribed. Because you might be surprised that there are some really commonly prescribed medications that can lead to weight gain, which then increase your risk of liver disease and heart disease. One really common one can be some of the mood medications. And as someone is taking medications for depression or anxiety, it's important to be aware of the potential for weight gain and to track that as we're tracking mood. Because as weight management specialists, we can do certain treatments to stop the weight gain that can occur if these medications are helpful and the patient needs to stay on them, and also to tailor the diet and nutrition plan so the patient will minimize weight gain taking certain medications. Another class of medications are steroids, and often these are a medication given as a last resort for serious conditions such as autoimmune conditions or other serious medical issues such as lung disease. Sarcoidosis is one that comes to mind. And we have to take these medications for our health, but they can cause weight regain. I think that really requires a referral to a specialist like myself to see what options we have to limit weight gain and the disease that can come as a result of weight gain that's related to medication.
Thank you, Dr. Lofton. Let's take a look at the next question.
What are some realistic changes in my health that I can make that do not feel extreme?
So, Dr. Lofton, we hear this a lot within the OAC community, and I think sometimes people think that in order to make a change, it has to be a drastic change. But this is a great question. So what are some things that folks can do that doesn't have to be extreme?
This is really relevant because I think there's so much focus on weight loss and the number on the scale going down, but we know that ultimately what improves metabolic health is the first step of lifestyle modification. And what does that mean? For example, in looking at treating MASH, formerly known as fatty liver disease, it has been proven that exercise, even without weight loss, is beneficial in decreasing the amount of fat on the liver. So this is huge, and we can find out how much benefit we can get by taking that extra walk. It does not have to be in the gym. Some people just are not gym people. Their time, equipment, finances may not allow for that. So we want to find that exercise, movement, even in the setting of not having weight loss, can really be helpful for that. And then fiber intake. I cannot stress enough how much we should look at the impact of eating the outsides of fruits and vegetables and keeping them as whole as possible when we're eating them. So for example, let's have the apple instead of the applesauce. And again, I'll just point out that when we look at our pantries, if there are foods that are ultra processed with a lot of preservatives, check the nutrition labels of those things and ingredients to see if we can find healthier alternatives that look more like the food's natural state.
Excellent, excellent, Dr. Lofton. And before we wrap up, is there one thing that you hope people take away from this conversation? And if so, what would that be?
The one thing I want our audience to know about metabolic health is it is a very indolent disease. It sneaks up on someone, and The inflammation that causes metabolic dysfunction is present far before we have abnormal labs. So if you feel dismissed by your provider, but you have symptoms such as fatigue, joint pain that can't really be explained, unexplained weight gain, seek a provider and seek a community such as the OAC that can help you with getting the confidence to seek out your resources, as well as helpful tips to make your metabolic health even better.
Thank you so much, Dr. Lofton, for sharing your knowledge and expertise today.
I'm really happy to be here on Fresh Perspectives, and I hope our audience has gained some insight into metabolic health and the benefits of joining a community like the Obesity Action Coalition.
Thank you so much. It's always a pleasure talking to you. And thank you to everyone watching and engaging with us today. Conversations like this matter, and they're only possible because of the OAC community of support. If this discussion was helpful to you, please consider making a donation at obesityaction.org/donate. Your support helps us continue creating the education, connectivity, and conversations just like this one. Until next time, take care.